Hi everybody, this is Ellen Matzer, one of the co-authors of Nurses on the Inside, Stories of the HIV/AIDS Epidemic in New York City. I am now going to play for you an interview that was done back in December of 1991 when I was the head nurse at the AIDS Center program on 8 East at Lenox Hill Hospital. A lot of this is mentioned in the book. And what's interesting is that this interview done in 1991 could very well be me talking today. So I hope you indulge me and listen to this because it's quite interesting on this day of World AIDS Day. Thank you and enjoy.
It's time for On the Beat with Mitch Levy on 103.5 FM WYNY. Our program deals with today's topical news issues and the people behind them. Here's your host, Mitch Levy.
About AIDS with Ellen Altman, who helped found the first designated AIDS unit in a New York City hospital. Ellen Altman has been working with AIDS patients since the disease was identified about a decade ago. She is currently the head nurse for the AIDS Center program at the Lenox Hill Hospital in Manhattan. Ellen Altman, welcome to On the Beat.
Thank you.
It is a pleasure to have you here today. Ellen, is there special training for nurses who work with AIDS patients?
Well, the training has evolved over the years. When we first started, nobody knew very much, and so we began to develop programs for nurses. What I look for when I hire somebody is the ability for them to be passionate about what they do, to just have human compassion, and the training, the actual knowledge of HIV disease and the clinical care I can teach them.
Is it difficult to find recruits? Are people still leery, still afraid?
In the nursing profession, I would say no. Many nurses have come forward wanting to contribute to this human health problem right now, and so I've not had any trouble recruiting nurses for my program.
Do you have an overabundance of people who actually want to do this?
As a matter of fact, at Lenox Hill we do have a waiting list to work in the AIDS Center program, and many of the other hospitals too are now overfilled with their staff of the AIDS Center programs.
What precautions do nurses take to protect themselves from exposure to the virus?
We use what the CDC recommends, which is universal precautions, and that is we wear gloves when we come in contact with blood, and we wear a mask if the patient has a respiratory problem such as tuberculosis. That is really the only time when we would wear a mask. If we are with a patient where soiling may happen of our clothing, we may choose to wear a gown, but usually that is not the case.
Why don't we describe basically what the AIDS Center program is? Now, you started, helped found the first one at St. Clair's Hospital, and now you're at Lenox Hill. Tell us what the program is, basically.
AIDS Center programs were founded by the New York State AIDS Institute to develop a process of coordinated care for all patients with AIDS. We know that they have periods of time when they are well and in the community, and periods of time when people will need to be hospitalized. And during such times, there may be additional care that is required to keep them out of the hospital. The concept of the AIDS Center program takes into account the needs for hospitalization, the needs the patients have in the community, medical, nursing, and psychosocial needs, and sort of puts them all together in a system that we call case management, whereas we are in contact with the patient from the time that they are diagnosed until the time they either leave our program, or some of them have died, of course, or they choose to go elsewhere. Some of them do leave New York State. But while they are in New York State and receiving care, it is the members of the team in each designated center that follow these patients throughout the course of their illness.
So it's a very personalized follow-up care program.
Yes, it is.
I would imagine today there are many more patients than beds.
Yes, there are, and that is why it's so important that we recognize symptoms and we can treat them early, very often while they are still an outpatient.
What was your role in establishing the very first designated AIDS unit of the AIDS Center program in a New York City hospital? When, where, and why did this happen?
Well, in 1985, this is after the virus has now been identified, and we are seeing an enormous number of people seeking health care for this. I was working at an intensive care unit in a Queens hospital, and we were seeing a fair amount of patients there, and it was very clinically interesting to me. And I also found that because of the fear, which was so rampant back then, that there were not many healthcare providers that wanted to work with people with AIDS. I saw an ad in the paper at that time for St. Clair's, who was advertising for their first designated center, and I did not know what that concept was about. And after speaking to the coordinator there, I decided that that was really where I wanted to be, because of the fear, because of the needs that these patients and their families have. And it really has become quite the essence of nursing. It is such a contribution to human health now, and I feel very strongly that this is where nurses' advocacy and support plays a very crucial role in the patient's well-being.
But now you find that that fear has greatly lessened. People are more knowledgeable.
Absolutely. People are definitely more knowledgeable, and I think that was owing to the development of all of the AIDS Center programs and people who chose to become more knowledgeable, and all the information that becomes disseminated from all the people doing research nowadays and from the Centers for Disease Control.
But you still use basically volunteers. People aren't assigned to AIDS units.
People are not assigned to this program, no. I would not accept anybody who was forced to work for me.
Why did you decide to focus your nursing career on the care of AIDS patients?
Well, again, when I was working back in the Queens Hospital in the intensive care unit, we had 2 patients with AIDS on the floor, and we were still practicing very strict isolation back then. And at that point, we knew how the virus was spread and how it wasn't, and we knew how you got it and how you didn't. And I went into the room without wearing masks, gowns, gloves, hats, and booties. And I was conferenced by my head nurse at the time for doing so, that I was putting my life in jeopardy and thus the lives of the other healthcare workers in jeopardy. And I said that in fact that was ridiculous, and that I could not catch AIDS by going into a patient's room and holding their hand and washing their hair. And I was so angered by it. The next day I handed in my resignation, and I said, I'm going to go work exclusively with people with AIDS, and I want to be one of the people that educates people with AIDS. If it were that easy to get, we would all be sitting around here comparing symptoms.
And that was a healthcare worker who should, in 1985, not that long ago, by then there was information out, and yet there was still this fear and stigma.
Yes, it was truly amazing.
Is the inevitable death and dying of the AIDS patients, many of them very young, is that emotionally draining on the nurses who care for them on a day-to-day basis? And if so, how do nurses of AIDS patients learn to accept this part of the job?
Well, it is sometimes a daily part of our work. I think that nurses realized that death is sometimes an appropriate conclusion to a patient's illness. Many people do suffer for a very long period of time. The infections leave them chronically debilitated, sometimes blind, unable to care for themselves, have drained the resources of the family, and are in great pain. And I think that it's very important for the nursing staff to help the patients through this process, to get the family through this process to the patient's death, which is many, many times very comfortable, very quiet, very peaceful. And we encourage those families that like to take part in that process, to be with their family member. And in some ways, it's very comforting to the nurse to realize that this patient is no longer suffering.
Do you find that AIDS patients require a special type of care, a special type of service, a little something extra?
Well, no more than any other patient. I mean, yes, they're special in some ways, as I think all my patients are special, no matter where I've worked. They deserve to be treated as adults. They deserve to be treated with respect. They deserve to make their own decisions about their health care or lack of health care. And it is really the nursing staff that supports that decision.
Your compassion is very evident from the way you speak and what you say. Do you in any way counsel patients? Is that part of your responsibility?
Mm-hmm. Yes, we counsel people through all the stages of their illness, from those people that have just been diagnosed being HIV positive and the implication of that for their health care in the future. We counsel people who have just been diagnosed with various infections and on the types of treatments that are available to them. We also counsel families on what to expect, and we also assist families in caregiving at home, how to care for somebody safely at home.
What about the families? Because I would think now in the healthcare field, you say people are now accepting of the disease, but I would think in the outside there's still that stigma.
It is not so much in New York City. People that have families in New York really have become very much involved in the care of their family member and are not frightened after very simple education. There have been the cases where families have come from other states, Wisconsin, Ohio, and they don't see AIDS that much out there, and perhaps their son or brother lives in New York City and they're sort of not used to it. Most families, when they come to New York, and especially come to Lenox Hill, get very intensive education from the primary nurses that are taking care of their family members. And in most cases, we have assist the family in achieving the comfort that they need to take care of their family member.
What can you say to them?
Well, what we can say is that it is okay to love your son or brother or father or husband, and it is okay to touch them, and it is okay to feel sorrow, but we always want you to have hope. Many of the infections that people get are very treatable. The lifespan of people with AIDS from the time that they are diagnosed HIV positive to the time they are diagnosed with an illness to the time that they may die is very long. People stay alive for very many years, and we have to focus on that, not on the eventuality that they may die, because there are some people that have been alive for a very long time.
And with this hope, Ellen, do you see a solution to this? I mean, obviously these are very tough economic times, and the money is not there in as great an amount, I'm sure, as you would like to see. And of course, governments from local to federal have been criticized for this, but we're in very tough times, and I don't think you're going to see a great change in the amount of dollars available. With what is available, is that optimism of yours, is there reason for it, do you think?
Well, nurses are very creative. And one of the things that I talk to my staff about is not standing so much on principles, and this is the way it should be, and we should have money for all of these things, but to change more to a resource-driven model in which you become more creative. Yes, we need money for more hospital beds, we need money for more research, we need to make drugs available, but they are very expensive. I think those activist groups are doing a good job that are putting pressure on certain drug companies to lower the prices of certain medications. There will never be enough money to take care of the people that are ill now, the people that are going to become ill in the future. There will never be enough money. And with our group of patients and other hospitals' groups of patients, you take care of the patients that you have now, and then you send them home, and you go on to the next patient and the next patient. If you think about it in terms of the thousands and tens of thousands, it will get overwhelming. So I ask that my staff, as I do is to think about the patients that we're caring for now, and not to worry about it so much who will be here tomorrow and the next day and the next month.
What medication is currently available to help AIDS patients, and how effective are these drugs?
Well, we know that there is a lot of research going on. Many people now are taking either AZT or DDI, which is a drug that is aimed at a certain part of the life cycle of the virus, and we know that that works. Many of the monies have been directed towards medications to treat the various infections that people get once their immune system is very deficient. We are seeing new treatments become available for those various infections, and there is further research on additional drugs to treat those infections for people who can't tolerate certain drugs. As far as vaccine development, there are early trials going on with vaccinations. Right now, there's one for people who are HIV positive but still have a rather high-functioning immune system. And what this does is sort of focus the immune system on where to direct its action. The immune systems of people with AIDS are really very not focused on what they should be doing when, and so this vaccination will allow them to focus on where to fight the virus.
And Ellen, what about research into prevention?
Well, research into prevention is education. We do need more money put into getting people trained to go out into the community, to reach those people that do not seek health care regularly, to seek adolescents, to seek women of childbearing age who are going to have babies. We need to protect our youngsters now, because those are the people that are going to be getting AIDS in the future.
That's what we're seeing now, that the illness is striking younger and younger people.
Yes, that is true.
This is On the Beat on 103.5 WYNY. I'm Mitch Levy, and my guest today is Ellen Altman. She is head nurse at the AIDS Center program at Lenox Hill Hospital. And a wonderful program it is, and you can hear how dedicated she is. We'll be back in just a moment. Now this.
Back now to On the Beat with Mitch Levy on 103.5 WYNY.
Thank you, and I'm back with my guest, Ellen Altman, who is head nurse at the AIDS Center program at Lenox Hill Hospital, at the AIDS clinic there, and we're talking about AIDS, of course. Let me ask you what Magic Johnson has done to help lessen the stigma of AIDS. Has there been a dramatic change? Have you noticed differences in people's attitudes since Magic came forward?
What we have noticed at Lenox Hill is that we are getting more calls from people seeking information. And we do take the time to talk to people on the phone, sometimes anonymously, and counsel them to either seek testing or seek additional education to protect themselves. I think it was a very good thing about Magic Johnson reporting his HIV status, and I think it will show other people that it's okay to be HIV positive. If you have had an exposure, then let somebody know about it, and let's see if we can't maintain your health for as long as possible.
How does the care of AIDS patients impact on hospital budgets?
Well, it impacts greatly. We are fortunate that the state has provided monies to hospitals who have designated AIDS centers. And so the reimbursement for hospitalization is a bit higher than it is for another type of medical patient. And so that eases the burden somewhat. The race for beds, if you will, is still very much an issue in all hospitals, since the number of people with AIDS hospitalized in New York City on any given day is approximately 1,400 people. And that's 1,400 beds that are being utilized by people with AIDS. So hospitals' response has been to develop these designated AIDS center programs and discrete units to provide for all of these patients.
Is the number in New York City on the upswing, the number of those infected with AIDS? We talked some years ago about only the tip of the iceberg. Well, are we getting deeper down, or is it still growing so dramatically?
Well, it is still growing, and I think we will see a large jump in the amount of cases that get reported as of January 1st of 1992, when the CDC has revised the case definition for AIDS. Up until now, you needed to have some type of infection to be classified as having AIDS. Starting in January, your T cells just need be below 200, and that will tell that this patient has AIDS. So we're going to see a very rapid incline in the amount of cases that get reported. It doesn't mean that there are more people, it just means that the reporting will be different. In New York City, yes, we are still seeing a lot of the minority populations getting infected and getting sick. And that is because they don't have a lot of the access to health care that other people do.
Now, what other groups? First, of course, we began with the gay male, and then the IV drug user and abuser. But now, of course, as Magic Johnson has so eloquently said, it could be you or I.
The category of exposure still remains the same, and that is by unsafe sex or unsafe use of IV needles, and of course from mother to newborn. Those are the categories of exposure.
Are we seeing an increase in, for instance, the number of women with AIDS?
Yes, we are seeing quite a dramatic increase in the number of women with AIDS, and traditionally women, especially those who have children, do not seek health care. That has been for years, as most mothers are worried about the impact that this will have on their children, and sometimes let their health go until such time as it is absolutely necessary for them to seek health care. And so women have been largely underreported and underrepresented in the actual numbers.
There could be large numbers of women who actually are HIV positive, who at this point have no knowledge of it themselves.
That's correct.
What do you recommend people do? Do you recommend people should be tested for AIDS?
If you had had this conversation with me 5 years ago, I would have said, if you are healthy and you think you're at risk, don't bother, because there's nothing we can do. There was no AZT. There was no prophylaxis against certain infections. Now I would tell people, if you think you're at risk, stop the risk behavior. If you think you've been exposed, get tested. See your physician. Seek counseling. Have an HIV antibody test and start medication if your immune system is deficient.
Now, the virus can be present and not show up in testing for some time, no?
Yes, that is true.
What causes this time lapse, and should people be retested?
Well, most often from the time of exposure to the time of development of antibodies occurs somewhere between 6 weeks and 6 months. During which time some people have reported a flu-like syndrome, which tells them that something is going on in their body, and usually at that time an antibody test will be positive. There are some people, for some reason, and we don't know that, who will not make antibodies to the virus for a very long period of time, and if they stay healthy, they don't really seek the test. The time from development of disease, from the time that one becomes HIV positive, we still do not know. That is an indeterminate amount of time.
All right, given your views now that because of AZT and DDI, that something can be done, let me ask you this question. Kimberly Bergalis, of course, who recently passed away, was very, very eloquent in her call for testing of HIV testing of medical workers. Many in your profession are against this. Now, how do you feel?
Well, I don't think that it will solve any problem to make it mandatory for healthcare workers to be tested. Healthcare workers know how to take precaution to prevent transmission of the virus. We do not share needles with our patients. We do not have sex with them. We will not transmit the virus if a healthcare worker should have it. I don't think that it will make any difference in the care of the patient to know whether their healthcare worker is infected or not. We do have plenty of healthcare workers that in fact are HIV positive, some of whom are ill themselves. And I think that patients may become more frightened, and it's really not necessary for them to know.
What about the psychology, just the psychological aspect of the fear that some people would have, and if they would know that the healthcare worker in question was not infected, would that put their mind at ease, and is there some benefit to that?
Well, I mean, you can't just look at somebody and know they're infected or know they're HIV positive. It all comes from stereotypes, and I think that that's wrong. If a nurse or a physician or a nurse's aide or a dietitian presents themselves to a patient in a very professional manner, as they all should, there would be no reason for that patient to even assume or not assume. It should not even be called into question.
Back to the numbers for just a moment. Is there any way to predict how many New Yorkers are likely to die of this disease over the next decade?
We know that presently in the United States there are about 200,000 people that have AIDS. Many of them have died already. New York City has about 1/10 of all the people with AIDS in the world. So we are very, very high on the scale. We see that patients are living longer now. We saw a big increase in the amount of deaths during the years 1988 and 1989, and that's because the people that initially started AZT were starting to fail in those 2 years, and so there was a big increase in the number of deaths. But now we are seeing a large decrease in the number of deaths because people are generally more informed and are seeking health care earlier. As far as the prediction of deaths, I mean, that would be very hard for me to say.
When you say that people are generally more well-informed, let me ask you, is the public well-educated as to how the disease is contracted and, alternatively, best avoided?
Well, we see the general numbers of people being infected, certainly in the gay community, going down. And so we know that there has been a large response on the part of the gay community to educate people about safer sex. We don't see that among women. We don't see that among the minority groups, especially Black and Hispanic. Those numbers are still on the rise. There are a wealth of organizations that are out there educating these people to seek health care and to take precautions. And I think we're going to sort of reach another tip before we start to see a decline in infection in those populations.
Have they not gotten the message, or do they, for whatever reason, choose to ignore it, do you think?
I think it's probably both. I think a lot of them have not gotten the message. Again, I think with Magic Johnson speaking publicly, I think a lot more will get the message. It's unfortunate that somebody famous has to come forward and disclose their diagnosis before people will seek health care. And I imagine that there are other celebrities that also will come forward and thus cause an onslaught of people seeking testing right now.
I know you're very concerned about the discrimination of an HIV patient, but let me ask you of hospital personnel, particularly in an emergency room and in surgery, do you treat all patients as if they had the virus?
Yes, that is the only way healthcare workers can protect themselves. You must assume everybody is infected, and you treat blood in the same manner, whether it's an 80-year-old woman from a nursing home or whether it's a young adolescent from Manhattan. You have to treat everybody's secretions in the same manner, and that's how nurses have managed to protect themselves.
Now, in terms of suffering, it causes, and the number of lives, of course, that it's likely to claim. How does AIDS compare to other health crises that mankind has had to face?
Well, in my experience as a healthcare worker, nothing has compared to the AIDS crisis. A lot of the epidemics, polio and earlier tuberculosis, I wasn't in healthcare back then, but nothing has devastated New York City and the world more than AIDS has. And more people have died from AIDS than died in Vietnam. And that's a very well-known fact. And so at this point, I cannot think of anything that is more devastating than this.
And you were saying before we went on the air that you were treating patients in the late 70s who probably had AIDS, but nobody heard of it. Had no idea what it was.
It was very interesting. Clinically, people were were being treated for infections and they were dying no matter what we did. And when we think back, my colleagues and I think back, we realize that these people probably had HIV back then.
In the minute we have remaining, what will it take to stop this AIDS? And are there reasons to believe there will be an effective worldwide effort to do so?
Well, this year's effort was sharing the challenge on World AIDS Day, and many hospitals got together and generated a response to commit themselves to education in the community, and I think that that is the effort that is required. In addition to all of the research as far as drugs are concerned, we need to raise everybody's awareness to this problem. It is everybody's problem.
Ellen Altman, thank you for sharing your story with us. We appreciate it.
Thank you for having me.
My guest on The Beat today has been Ellen Altman. She is the head nurse for the AIDS Center program at Lenox Hill Hospital in Manhattan. I'm Mitch Levy. Thank you for listening, and good morning.
You've been listening to On the Beat with Mitch Levy, a program focusing on the many complex issues shaping our world today. Join us next Sunday morning at 6 for another